The federal government has flagged off the second phase of COVID-19 vaccination, but there are still concerns and fears by some people who are skeptical on getting the jab. Over time, there have been myths regarding the vaccines and the COVID-19 pandemic, with some of them contributing to people rejecting and stalling the vaccination process. But for a pandemic as this, we advise people to disregard unproven myths and stick to the facts that we are better safe than sorry. That's all we'll be talking about in the next couple of minutes. Joining me now via Zoom for this discussion is Dr. Japhet Olugbogi. He's the Chairman Committee on Infectious Diseases, Nigerian Medical Association, Lagos, and State Medical Officer of Health for Apapa Igomu Local Council Development Area. It's nice to have you join me, Dr. Olugbogi.
Thank you for having me this morning.
Great. Now, the greatest concern right now is the issue of the third wave, which we all say we are in right now. But as much as we have that, and there are practical evidences that there are still people dying out there from the reports we're getting from NCDC and Ministry of Health, people still don't feel that there's fire on the mountain. What is your take on what you think is responsible for this?
Well, thank you very much once again for having me on the show this morning. Well, previously, a lot of people were skeptical about whether they should take the vaccine or not, or whether COVID was real or not. But right now, a lot more people have believed that COVID is real, especially given this third wave of the COVID-19 pandemic in Nigeria. So I can tell you categorically that a lot more people are coming out now to ask for the vaccines. A lot more people are coming out to ask for what they can do to protect themselves and their family members. So the distrust that people had before is waning gradually. Yes, we still have some doubting Thomases out there, but the distrust is waning gradually, and a lot more people are opening up to the fact that there's reality of COVID-19 pandemic in Nigeria, especially given this third wave, where we have the Delta variant that is more virulent and more transmissible than the other variants of the virus in Nigeria.
All right. Now, apart from the vaccines, the people taking the vaccine, like you said, how about the issue of the safety measures and all the non-pharmaceutical protocols that everyone is supposed to adhere to? What are you seeing from that perspective? Because from our reports and our observation, people are not necessarily adhering to those safety standards.
Yes, I will agree with you. A lot of people are not adhering to these standards. But then again, if you compare our country to some European countries or America, you would see that in our public places, especially the banks and the malls, people cannot gain access to these places without wearing their face masks. Yes, we have people on the streets who still don't obey all these safety protocols and measures, but a lot more people, I think, are opening up more to this now. So we can just continue to encourage people to continue to wear their face masks, observe the safety protocols, observe social distancing, wash their hands as many times as possible, use hand sanitizer as many times as possible. I think what we need to do is continue to reinforce this in people. For now, a lot of people have begun to live with the fact that they wear their face masks anywhere and everywhere they are. But we are in a society of so many different types of people and millions of people. So there are bound to be people who would not obey these safety measures. But we just continue to create the awareness. We just continue to reinforce these safety protocols and measures to them so that it can become part of them.
Okay. Now let's talk about the issue of the vaccines. People are still confused regarding if they can take part of one vaccine and then another vaccine comes and they can take again. For instance, the AstraZeneca vaccine that had been administered at first, there are people who have taken that, and now we have the Moderna, and even the Johnson & Johnson is part of it is in the country. Some people are still feeling they have to continue taking this again. What is your advice? Let's get this clarification so people understand how to go about it.
Yes, for now, the MPAC, the WHO, and even the Nigerian Medical Association advises that whoever has taken the first dose of the AstraZeneca should stick to AstraZeneca and not mix vaccines. We have now in the country another set of doses of AstraZeneca. So those who have taken their first doses should just proceed to the various centers where vaccines have been administered to take their second doses. We have enough doses in Nigeria to give the second dose, the second jab of the AstraZeneca to people. And then for the Moderna, the Moderna is for first timers, those who have not had any dose of AstraZeneca at all. So there is enough vaccines to give them and to take a second dose. That part of that Moderna is going to be kept for those who take their first dose now, so that they can have their second doses 4 weeks later. So we want to advise that people don't mix vaccines. They should stick to one. If you take AstraZeneca, take the second jab of AstraZeneca. If you take Moderna, kindly ensure you take the second jab of Moderna.
All right. A lot of people are still asking, where can we get these jabs? Now, I know that the Lagos state has, designated some places for where people can take these jabs. But can you give some level of clarity? Do you have to go to a general hospital or a primary healthcare center, or there are special places for people to take the jabs?
Yes, there are about 88 sites that has been released by the Lagos State government where people can get these jabs. It's all over social media. And if people can't have access to them, we will mediate so that they release a fresh list and circulate them widely so that people can have access to them. But then again, the comprehensive health centers, there is one in each LGA, LCDA of the state. So people can proceed to these sites. They can get their vaccines there. Apart from that, there are also some designated general hospitals. It is not all of them. So they may have to get advice on where to go. But there are some designated general hospitals where people can get their vaccines. Apart from that, you can call the number of the medical officers of health in your LGA or LCDA. They can advise rightly where to get the vaccines. But we are going to mediate so that these sites and phone numbers of the contact persons, that is the medical officers of health who are the custodians of these vaccines at the local government primary health care level, so that they can do the needful.
All right. Besides that, everyone can maybe find out from the closest primary health care center, and you will get direction to where, because at every local government, I believe that there is a designated primary health care center, or at least a center, a clinic in every local government. So
yes, absolutely.
All right, very good. Now, there's one more question I'm going to ask when it comes to what the kind, because when we engage with people, the kind of questions they ask, it tells that there are people who are willing, but they don't have some information. Now, the issue of when you take this jab, whether you don't have to take again for 6 months or for 1 year or for life, people are still asking these questions. Can you give us some clarity in that regard? Or we wait for government when, if they're ready and there is need for people to take the jab again, if need be, after a year or 2 or 3 or 4 or 5 or 10, that might come up. Can you give us clarity in that area?
Yes, for now, the vaccines are safe and effective. And once you have your 2 doses of AstraZeneca and Moderna, for now, the literature says that it's for life. We don't need to take any booster dose, at least for now. So if you have 1 dose, you should wait for 4 weeks for AstraZeneca, for Moderna to complete your jab. If you take the first dose, you should wait for 6 weeks for the AstraZeneca to take your second jab. And once you have those 2 jabs, you are covered. You are fully vaccinated against COVID-19. Now, the vaccines are safe and effective, and they are free at all these centers. So I can tell you categorically that a lot more people have been asking for the vaccines even before they came. Every day, people like us get not less than 15 to 20 calls. So the awareness is out there, and people are willing to take the vaccines. Let me also please stress that the vaccines do not have magnetic substances. They do not magnetize. They do not have chips. The vaccines are safe. There is no way healthcare workers and the medical community would allow people to take vaccines that are dangerous to them. So the vaccines are safe, and people should feel free to take the vaccines. Let me also add now that this second phase of the vaccination is open to everybody above age 18. So anyone at all who has not been vaccinated should kindly proceed to all these vaccination centers and get their jabs once the rollout begins in Lagos and in everywhere in Nigeria.
All right. Thank you so much, Dr. Japhet Olubogi. It is good you made that clarification, because a lot of people, so many videos on social media with the issue of people putting a key there and it sticks and it says, oh, there's a magnetic substance in there. And then others are using a light bulb to, you know. All right.
It is just propaganda.
Okay. Thank you very much for clarifying all of that. We wish you well, and thank you for everything you're doing. Thank you.
Thank you very much for having me.